Your options for periodontitis when deep cleaning isn't enough. It's completely natural to prefer the least invasive approach to any health issue, and when it comes to gum disease, many patients hope that deep cleanings, scaling and root planing, or SRP, combined with antibiotics will be enough to resolve the problem. While this approach is a cornerstone of periodontal care, this article will help you understand why more advanced options, including surgery, might be recommended for persistent bone loss. We'll delve into the role and limitations of various antibiotic and antimicrobial medications, both prescription and over-the-counter like PerioRestore, discuss what to look for if you choose non-invasive treatments, explain why deep cleaning alone might not suffice for advanced cases, outline the necessity of a staged treatment approach, including osseous surgery, and provide insights into what to expect during and after surgery, including potential aesthetic impacts and long-term success. We'll also touch upon other approaches for bone loss, like regeneration, and causes of bad breath beyond oral bacteria. Our goal is to empower you with information to make the best choice for your oral health. Validating your preference for less invasive care. Your desire to avoid surgery is understandable. Non-surgical treatments like deep cleaning are indeed the first line of defense for periodontitis. They're highly effective at removing the bacterial plaque and tartar, calculus, that cause inflammation and bone loss. When combined with excellent daily oral hygiene, these treatments can significantly reduce infection, calm inflammation, and even lead to a reduction in pocket depths as your gums heal and tighten. In many cases, particularly mild to moderate periodontitis, this non-surgical approach is all that's needed to stabilize the disease. The role of antibiotics, an important adjunct, not a standalone cure. Antibiotics can be a valuable tool in fighting periodontitis. Topical, local, antibiotics can be placed directly into deep pockets after a deep cleaning, delivering a concentrated dose of medication right where it's needed. Systemic, oral, antibiotics might be prescribed for short courses, especially in cases of aggressive periodontitis, acute infections, or when local therapy needs an extra boost. However, it's vital to recognize that antibiotics are almost always used as an adjunct, meaning a supplement, to mechanical cleaning, not a replacement for it. They target bacteria, but they have key limitations in managing periodontitis. Biofilm resistance. The bacteria causing periodontitis live in sticky, organized communities called biofilms, plaque and tartar. These biofilms are notoriously resistant to antibiotics, often hundreds or thousands of times more resistant than free-floating bacteria. Antibiotics struggle to penetrate this protective matrix. No physical removal. Antibiotics cannot physically remove hardened tartar or reshape the irregular bone defects that are a consequence of long-standing periodontitis. These physical barriers are what allow bacteria to constantly recolonize. No pocket elimination. While antibiotics can temporarily suppress bacterial levels, they don't physically eliminate the deep pockets themselves. As long as these deep, uncleanable spaces exist, bacteria will inevitably return, leading to recurrence of the disease. Antibiotic resistance concerns. Over-reliance on antibiotics for chronic conditions can also contribute to the broader public health issue of antibiotic resistance, potentially making them less effective when truly critical for other infections. Understanding the antibiotic and antimicrobial medications available for non-invasive therapy. If your periodontist determines that adjunctive therapy is appropriate for your specific case, offering flexibility and a less invasive approach, there are various medications available. These broadly fall into local, topical, and systemic, oral, delivery, and also include non-antibiotic antimicrobial options like hydrogen peroxide. It's crucial to remember that these are always used in conjunction with mechanical cleaning like scaling and root planing, SRP, for optimal effectiveness. Local, topical, antibiotics. These medications are placed directly into the periodontal pockets, providing a high concentration of the antibiotic at the site of infection with minimal systemic side effects. They are typically used after a deep cleaning to target persistent or localized areas of infection. Commonly available local delivery antibiotics include minocycline microspheres, e.g., Arestin. These consist of tiny, spherical particles containing the antibiotic minocycline. They are delivered as a powder into the gum pocket and adhere to the pocket wall, slowly releasing the antibiotic over several days to weeks. This allows for a sustained therapeutic effect directly where it's needed. Doxycycline hyclate gel, e.g., Atrodox. This is a gel formulation of doxycycline that is injected into the gum pocket. It then solidifies, slowly releasing the antibiotic as it biodegrades over time. Chlorhexidine gluconate chip, e.g., Periochip. While technically an antiseptic rather than an antibiotic, chlorhexidine is a powerful broad-spectrum antimicrobial agent. This small, biodegradable chip is placed into the pocket and releases chlorhexidine for an extended period, effectively reducing the bacterial load. Metronidazole gel/strips, e.g., Elozole. These formulations deliver metronidazole directly into the pocket, specifically targeting anaerobic bacteria, which are prevalent in periodontal infections. Advantages of local delivery. High concentration at the site of infection delivers the medication exactly where it's needed most. Minimal systemic side effects, less impact on the rest of the body compared to oral antibiotics, reducing concerns like widespread digestive upset. Reduced risk of systemic antibiotic resistance. Less widespread exposure to antibiotics means a lower contribution to the broader public health issue of antibiotic resistance. Limitations of local delivery. Limited to accessible pockets, can only treat areas where the material can be effectively placed by your dental professional. Not a standalone treatment, still requires prior mechanical debridement, SRP, to be effective, as it cannot physically remove tartar. Systemic, oral, antibiotics. These medications are taken as pills and are absorbed into the bloodstream, traveling throughout the body to reach infection sites. Systemic antibiotics are generally reserved for more widespread or aggressive forms of periodontitis, acute infections, like abscesses, or when localized therapies haven't been sufficient. They are almost always used in conjunction with scaling and root planing. Commonly prescribed systemic antibiotics for periodontitis include tetracyclines, e.g., doxycycline, minocycline. These are frequently used due to their broad-spectrum antibacterial properties against many periodontal pathogens. Doxycycline, in particular, is sometimes prescribed in low, subantimicrobial doses, e.g., Periostat, to reduce the activity of collagenase, an enzyme that breaks down gum tissue, without directly targeting bacteria, thereby helping to modulate the host's inflammatory response. Metronidazole. This antibiotic is highly effective against the anaerobic bacteria that are characteristic of periodontal pockets. It's often prescribed alone or in combination with other antibiotics, such as amoxicillin, for a broader spectrum of coverage in more severe or resistant cases. Amoxicillin, a penicillin-class antibiotic, often used as part of a combination therapy with metronidazole to target a wider range of bacteria. Azithromycin, a macrolide antibiotic known for its anti-inflammatory properties and its ability to accumulate in tissues, leading to a prolonged therapeutic effect. It's often prescribed for a shorter course. Clindamycin may be considered in cases where patients have allergies to penicillin or for infections that are resistant to other common antibiotics. Advantages of systemic delivery. Reaches widespread infections, can treat bacteria throughout the oral cavity and body, making it suitable for generalized periodontitis. Effective for aggressive forms of periodontitis, can help control rapidly progressing disease and acute flare-ups. Limitations of systemic delivery. Systemic side effects can include gastrointestinal upset, nausea, diarrhea, allergic reactions, and increased risk of yeast infections, e.g., oral thrush. Risk of antibiotic resistance. Broader exposure to antibiotics can contribute to the development of resistant bacterial strains, a significant public health concern. Less concentrated at the specific infection site, the medication is diluted as it travels through the bloodstream compared to direct local application. Cannot remove physical barriers. Systemic antibiotics do not physically remove hardened tartar or reshape the bone defects that contribute to deep pockets. Non-antibiotic antimicrobials for at-home use, e.g., hydrogen peroxide, mouthwashes. Beyond traditional prescription antibiotics, a range of over-the-counter, OTC, non-antibiotic antimicrobials offers flexible, non-invasive options for daily bacterial control and addressing issues like bad breath. Periorestore, 1.7% hydrogen peroxide, with moldable trays. Mechanism. Periorestore is an OTC oral cleansing gel whose active ingredient is 1.7% hydrogen peroxide. Hydrogen peroxide is a powerful oxidizing agent that releases oxygen radicals upon contact with bacteria, damaging their cell walls and other components, effectively killing them. It is particularly effective against the anaerobic bacteria that thrive in low-oxygen environments of periodontal pockets and are often responsible for bad breath, by neutralizing volatile sulfur compounds. Periorestore kits are designed to be used with boil and bite, moldable mouth trays, which allow the gel to be held against the gums and reach into the gum line more effectively than traditional rinsing, enhancing contact time and penetration into shallower pockets. Effectiveness in killing bacteria and addressing bad breath. Periorestore is effective in killing oral bacteria and is widely recognized for its ability to reduce bad breath stemming from bacterial imbalances. This unique tray-based delivery system provides a more targeted at-home bacterial reduction in gum pockets than standard rinses. Advantages: non-antibiotic, no resistance concerns, freshens breath, can offer some mild teeth whitening, and is relatively gentle. The tray system offers targeted delivery beyond regular rinsing. Limitations: while boil and bite trays help, they are not as precisely fitted or designed for deep pocket sealing as custom fabricated trays made by a dental professional, e.g., the Perio tray often used in the professional Perio Protect method. Therefore, their ability to deliver medicament into the deepest and most complex periodontal pockets, e.g., 5 mm or more, might be limited compared to professional methods. Hydrogen peroxide might cause some temporary tooth sensitivity in some individuals. Over-the-counter mouthwashes with antimicrobial agents. Essential oils, e.g., Listerine antiseptic. These mouthwashes contain a blend of essential oils, like thymol, eucalyptol, menthol, methyl salicylate, that disrupt bacterial cell walls. They are effective at reducing supragingival, above the gum line, plaque and gingivitis and kill a broad spectrum of bacteria. However, their ability to penetrate deep into periodontal pockets and disrupt established subgingival biofilms is limited compared to tray-based systems or professional treatments. Some contain alcohol, which can be drying, and they can cause a strong sensation. Cetylpyridinium chloride, CPC, e.g., Crest Pro Health, Scope CPC product. CPC is a quaternary ammonium compound that binds to bacterial cell walls, disrupting their function. It's effective at reducing plaque and gingivitis and is available in alcohol-free formulations. Similar to essential oils, CPC mouthwashes primarily act on accessible surfaces and have limited penetration into deep pockets. They can sometimes cause temporary staining. Stannous fluoride, e.g., in some Crest Pro Health toothpaste/rinses. Beyond its cavity-fighting properties, stannous fluoride also possesses an antibacterial effect by interfering with bacterial metabolism and adhesion. While effective for overall plaque and gingivitis control and reducing tooth sensitivity, its primary role isn't deep periodontal pocket penetration. It can sometimes cause temporary staining in older formulations. Natural/home remedies, use with caution and consultation. Saltwater rinses, provide mild antiseptic and soothing benefits, helpful for inflammation and healing. Their bactericidal power against aggressive periodontal pathogens is limited. Oil pulling, e.g., coconut oil involves swishing oil to mechanically dislodge bacteria, with some oils having mild antimicrobial properties. Evidence for deep bacterial killing is less robust compared to established antimicrobials. Herbal extracts, e.g., tea tree oil, oregano oil. Many herbs have demonstrated antimicrobial properties in lab settings. However, concentrated essential oils must be heavily diluted for oral use due to their potency and potential for irritation or toxicity. Their efficacy and safety for managing complex oral biofilms in chronic periodontitis, in an unregulated OTC form, are not as well established. Always consult your dentist before using highly concentrated herbal extracts orally. Which is better in killing bacteria among OTC options? The concept of better depends on the target and specific needs. For broad surface bacterial reduction and general gingivitis management, OTC mouthwashes with essential oils or CPC are very effective and widely used. For targeted delivery into shallower to moderate periodontal pockets and overall biofilm management for daily maintenance, PerioRestore with its included boil and bite trays offers a unique advantage over standard OTC rinses. Its tray-based delivery allows for longer contact time and better penetration into the gum line and shallow pockets, making it a highly effective non-invasive option for at-home care. For deep periodontal pockets or established, difficult-to-reach subgingival biofilms, no OTC product, including PerioRestore with boil and bite trays, can fully replicate the effectiveness of professional scaling and root planing. For these deeper issues, professional intervention, including localized prescription antimicrobials placed by a dentist or the more precisely fitted custom-fabricated trays, like the Perio tray, may be necessary. These professional options are designed for deeper, more aggressive biofilm disruption. In essence, PerioRestore with its tray system provides a valuable and distinct at-home approach to bacterial control, particularly for improving gum health and combating bad breath, making it a strong contender among non-invasive OTC options for flexible patient use. However, it functions as an excellent adjunct to professional care, not a replacement for comprehensive periodontal treatment in advanced cases. What to watch for if you choose PerioRestore or similar non-invasive treatment. If you opt for PerioRestore or other non-invasive, at-home treatments for managing your periodontal health, it's crucial to understand that these methods are adjuncts to professional care, not replacements, especially for periodontitis. Vigilance for specific signs is key. 1. Consistent adherence and technique. Daily, consistent use. Non-invasive at-home treatments like PerioRestore rely heavily on daily, consistent application. If the product isn't used exactly as directed, e.g., using the trays for the recommended duration, every day, its effectiveness will be significantly compromised. Proper technique. For PerioRestore, ensuring the boil and bite trays are correctly molded and worn so the gel has good contact with the gum line is important. For rinses, ensuring proper swishing time is necessary. Continued excellent oral hygiene. These products do not replace the fundamental importance of thorough daily brushing, including tongue brushing and flossing. Patients must maintain meticulous daily oral hygiene practices. 2. Signs of worsening periodontal disease, despite treatment. These are critical indicators that your at-home regimen might not be sufficient, and prompt professional intervention, which could include more advanced non-surgical or surgical options, is necessary. Persistent or increasing bleeding, gums that continue to bleed easily when brushing, flossing, or even spontaneously, despite consistent use of the product, are a major red flag. Healthy gums should not bleed. Increasing gum swelling, redness, or tenderness, while initial healing might reduce some inflammation, if the gums remain puffy, red/purplish, or become increasingly tender or painful, the infection is likely not under control. Persistent bad breath or unpleasant taste. If the chronic bad breath or metallic taste doesn't improve or worsens, it indicates that odor-producing bacteria are still thriving, often in deep, inaccessible pockets. Receding gums worsening. While some gum recession can be a natural part of the healing process as inflammation subsides, increasing recession that exposes more root surface can indicate ongoing bone loss. New or worsening tooth sensitivity. This can be a sign of increased root exposure due to gum recession or deeper pocketing affecting the tooth's nerve. Loose or shifting teeth. This is a late-stage sign of significant bone loss. Any new or increasing tooth mobility is a serious concern requiring immediate professional evaluation. Changes in bite. If teeth feel like they are shifting or your bite feels off, it can be a sign of progressive bone loss around the teeth. Pus or abscesses. The presence of pus extruding from the gum line or a painful, swollen bump, abscess, indicates an active, severe infection that requires immediate dental attention. Deepening periodontal pockets. As measured by a dentist, this is the most objective measure. Regular dental checkups, including periodontal probing, are essential. If pocket depths are not reducing or are increasing in certain areas despite at-home efforts, it's a clear sign the disease is progressing. Three Side effects to monitor. While Periorestore, 1.7% hydrogen peroxide, is generally safe, and most OTC products are well tolerated, patients should be aware of potential side effects. Tooth sensitivity. A temporary increase in sensitivity to hot or cold is possible, especially with hydrogen peroxide products. If it's severe or persistent, the patient should contact their dentist. Gum/mouth irritation. While low concentrations are generally safe, some individuals might experience irritation, redness, or burning sensation in the gums or oral tissues. If this occurs, they should reduce frequency or discontinue use and consult their dentist. Unpleasant taste or dry mouth. Some users might report a metallic or altered taste, or a feeling of dryness, especially with certain mouthwash products. Staining. While hydrogen peroxide can whiten, some other antimicrobial rinses, like chlorhexidine gluconate, though typically prescription only, are known to cause temporary brown staining on teeth, fillings, and the tongue. Periorestore itself is less likely to cause this. Four, the indispensable role of regular professional monitoring. This cannot be stressed enough. Even with diligent at-home care using non-invasive treatments, regular periodontal maintenance appointments are absolutely critical. Professional assessments. Only a dentist or periodontist can accurately measure pocket depths, assess bone levels, via X-rays, identify areas of persistent inflammation, and detect subtle signs of disease progression that a patient might miss. Professional cleanings. Even the best at-home care can't remove calcified tartar, calculus, that accumulates below the gum line. Regular professional cleanings are essential to remove these bacterial strongholds that serve as reservoirs for infection. Guidance and adjustments. Your dental professional can provide personalized advice, adjust your at-home regimen if needed, and recommend a more aggressive treatment, like localized prescription antibiotics, custom-fitted trays for deeper delivery, or surgical intervention, if non-invasive methods prove insufficient to control the disease. In summary, choosing Periorestore or similar non-invasive at-home treatments offers a flexible way to manage oral bacteria. However, patients must understand its role as an adjunct to professional care and be vigilant for any signs that the disease is not being adequately controlled, ensuring they promptly seek professional evaluation if concerns arise. This partnership between diligent home care and regular professional monitoring is key to achieving and maintaining long-term periodontal health. Why deep cleaning and antibiotics might not be enough for advanced cases. For areas with significant bone loss and deep periodontal pockets, typically 5 mm or more, relying solely on repeated deep cleanings and intermittent antibiotics or antimicrobials often falls short of achieving long-term stability. Here's why. Accessibility limits. Even with the most skilled hands and specialized instruments, it's incredibly challenging, and often impossible, to thoroughly clean the very bottom of extremely deep pockets and areas where the bone has been destroyed in an irregular way, like bone craters or furcations between roots of molars. Persistent bacterial havens. These deep, anatomically compromised pockets act as ongoing, bacterial traps. Even if antibiotics or antimicrobials temporarily knock down the bacterial population, as long as these physical hiding spots remain, bacteria will quickly recolonize, and the inflammatory cycle that leads to bone loss will continue. Structural problem requires structural solution. Periodontitis, at its core, creates structural damage to the bone. While non-surgical methods address the infection, they generally cannot reshape bone defects or significantly reduce deep pockets in areas where the bone has been severely compromised. The necessity of a staged approach. This is why periodontal care follows a staged approach. Initial non-surgical therapy. We always start here. Deep cleaning, SRP, and improved home care are foundational. Reevaluation. After a healing period, typically 4 to 8 weeks, your dental professional will reevaluate your gums. Many areas will show significant improvement and can be managed with ongoing maintenance. Targeted surgical intervention. For areas where deep pockets, e.g., 5 mm or more, stubbornly persist despite thorough non-surgical treatment, it signals that there's an underlying anatomical issue that non-surgical methods simply cannot resolve. This is when surgical options, such as osseous surgery, are considered. Understanding gum healing after osseous surgery. Can gums fail to reattach? It's a very perceptive and important question to ask if the gum tissue, once lifted during osseous surgery, can fail to heal or reattach properly. While a complete failure of the gum to heal at all is rare, the quality and extent of that reattachment can vary, and this directly impacts both the functional and aesthetic outcomes. Your gum tissue possesses a remarkable natural ability to heal. During osseous surgery, the gum isn't permanently cut away. Instead, very precise incisions are made to gently lift it back, like lifting a curtain, to expose the underlying tooth roots and the bone around them. This allows for meticulous cleaning of deep bacterial biofilms and reshaping of irregular bone contours. Once this work is completed, the gum tissue is carefully repositioned and often secured with fine sutures, stitches, to hold it snugly against the tooth and bone. Your body's natural healing processes then begin. Initial healing. Days 1 to 7 a protective blood clot forms, and healing cells rush to the area. Tissue reattachment. Weeks 1 to 4 the gum tissue actively begins to reattach to the cleaned root surfaces and healthy bone, forming a new, secure seal. Full maturation. Months. While initial healing is quick, the full strengthening and maturation of the new gum attachment can take several months. Factors that influence successful reattachment include thoroughness of cleaning. Any remaining plaque or diseased tissue can hinder healing. Patient's home care. Meticulous oral hygiene post-surgery is crucial to prevent new bacterial accumulation. Smoking status. Smoking significantly impairs healing and can compromise reattachment due to reduced blood flow. Systemic health. Conditions like uncontrolled diabetes can negatively impact the body's healing capacity. Surgical precision. The surgeon's careful handling of delicate tissues is vital. While achieving biological perfection isn't always guaranteed, the goal is always a strong, healthy, and stable reattachment that significantly reduces pocket depths. If, during post-surgical reevaluation, an area hasn't healed as ideally as hoped, e.g., deeper pockets persist, this doesn't necessarily mean a complete failure. It might indicate a need for even more meticulous localized home care, or in very rare cases, a minor, localized adjustment might be considered. The vast majority of patients experience successful healing and a return to significantly healthier gums. The patient experience: what to expect during and after osseous surgery. The idea of any surgery can be unsettling, but knowing what to expect can significantly ease concerns. During the procedure: anesthesia and comfort. Osseous surgery is performed under local anesthesia, meaning the area being treated will be completely numb. Your periodontist will ensure you are comfortable throughout the procedure. For those who experience dental anxiety, sedation options, such as nitrous oxide or oral conscious sedation, are often available to help you relax. Procedure steps: after the area is numb, precise incisions are made to gently lift the gum tissue. This allows the periodontist direct access to the underlying tooth roots and bone. They will meticulously remove all plaque, tartar, and diseased tissue, and then carefully reshape the bone to eliminate deep pockets and smooth irregularities. Finally, the gum tissue is repositioned and secured with tiny sutures, often with a protective dressing placed over the surgical site. Duration: the length of the procedure varies depending on the number of areas being treated, but it can range from 1 to several hours. After the procedure, recovery period. Immediate post-op: it's normal to experience some mild to moderate discomfort, swelling, and possibly some minor bleeding or oozing for the first few days. Your periodontist will provide detailed postoperative instructions and may prescribe pain medication, such as ibuprofen or a stronger analgesic if needed, to manage any discomfort. Applying an ice pack to the outside of your face, 20 minutes on, 20 minutes off, during the first 24 to 48 hours can significantly help reduce swelling. Diet: a soft diet will be recommended for the first few days to a week. Avoid hard, crunchy, or sticky foods that could irritate the surgical site or dislodge sutures/dressing. Hydration is key. Oral hygiene: you'll be instructed on how to gently clean the surgical area. This often involves avoiding direct brushing or flossing on the surgical site for a period, instead using prescribed antimicrobial mouth rinses, like chlorhexidine, to keep the area clean. You should continue to brush and floss all other non-surgical areas as usual. Activity: limit strenuous physical activity for the first few days to prevent increased bleeding or swelling. Follow-up appointments: you'll have follow-up visits within a week or two for your periodontist to check on healing, remove any non-dissolvable sutures, and provide further guidance. Sensitivity: it's common to experience temporary tooth sensitivity, especially to cold, as the root surfaces may be more exposed. This typically diminishes over several weeks or months. Sensitivity toothpaste can often help. Full healing: while initial healing occurs quickly, the full maturation and strengthening of the gum tissue can take several months. Following all postoperative instructions carefully is crucial for optimal healing and long-term success. The aesthetic impact of osseous surgery: understanding expected changes. You are absolutely right to be concerned about the aesthetic outcome. It's important to understand that osseous surgery, while highly effective functionally, does cause aesthetic changes, primarily in the form of gum recession. This is not a failure of the surgery, but rather a direct and often intended consequence of achieving optimal health. Expected recession: teeth look longer. Osseous surgery is a resective procedure. Its main goal is to reduce deep periodontal pockets by reshaping the underlying bone and repositioning the gum tissue to a healthier, shallower level. When the gum tissue heals and reattaches to this newly contoured bone, it will almost always result in the gum line settling lower than its pre-surgical, often swollen and diseased, position. This means more of the tooth root surface becomes visible, and the teeth will appear longer. This is considered a successful functional outcome: healthy, shallow pockets, but it is an aesthetic change that many patients might perceive as unfavorable if not fully prepared for. The amount of recession is generally predictable and proportional to the initial pocket depth. Black triangles, open spaces between teeth. If significant bone and gum tissue were lost due to the disease between teeth, and the surgery cleans and stabilizes this area, black triangles, small, dark spaces between the teeth near the gum line, may become more pronounced. Again, this is often an unavoidable consequence of treating advanced disease and creating a maintainable, healthy environment. Irregular gum line, less common complication while the goal is a smooth, even gum contour. If healing is severely compromised, e.g., by infection, smoking, or very complex anatomy, or if there are challenges in tissue adaptation, it could potentially lead to an irregular or scalloped gum line that is less aesthetically pleasing than desired. However, this is less common than the predictable, overall recession. Understanding the data on aesthetic outcomes, there isn't a single, simple, rate for osseous surgery leading to an unfavorable aesthetic outcome statistic, largely because unfavorable is subjective. However, research extensively documents the average amount of expected recession, e.g., 1 to 3 mm or more, depending on initial pocket depth. The stability of the new gingival margin after healing, which is typically high, indicating successful reattachment. While patients undergoing these procedures for functional reasons often express satisfaction with their improved health and symptoms, even with expected recession, it's crucial for your periodontist to have an in-depth conversation with you about the expected aesthetic changes specific to your case, especially if the surgery involves teeth visible in your smile. This discussion is vital for setting realistic expectations and ensuring the treatment aligns with both your functional health needs and your aesthetic preferences. The goal of surgery: creating a maintainable environment and long-term success rates. Surgical procedures like osseous surgery don't replace deep cleaning and other non-surgical therapies, they complement them by addressing the physical consequences of the disease. By gently lifting the gum tissue, the periodontist gains direct access to meticulously clean the entire root surface and, crucially, reshape the underlying bone. This reshaping eliminates bacterial traps and reduces pocket depths to a level that you can effectively clean at home and that can be managed during regular professional maintenance. This physical alteration is key to truly halting disease progression and preserving your teeth long-term. Success rates and tooth preservation. Osseous surgery, when indicated and followed by diligent home care and regular professional maintenance, has a high success rate in achieving its primary goals. Pocket depth reduction. Studies consistently show significant and sustained reductions in periodontal pocket depths, often bringing them down to a healthy, maintainable level, typically 3 mm or less in many areas. Halting disease progression. The procedure is highly effective in stopping the progression of bone loss and inflammation. Long-term tooth retention. Perhaps most importantly, osseous surgery plays a critical role in preserving natural teeth that would otherwise be at high risk for extraction due to advanced periodontal disease. By creating a stable, cleansable environment, it provides a strong foundation for the teeth for many years. While individual results can vary based on factors like the severity of the initial disease, smoking status, systemic health conditions, e.g., uncontrolled diabetes, and patient compliance with postoperative care and maintenance, success rates often exceed 85% in terms of maintaining the treated teeth over the long term. It's important to understand that while osseous surgery effectively manages the disease and creates a healthy environment, it doesn't cure periodontitis outright. Periodontal disease is a chronic condition that requires ongoing vigilance. The success of the surgery is strongly dependent on the patient's commitment to excellent daily oral hygiene and adherence to the recommended schedule of professional periodontal maintenance appointments, often every 3 to 4 months. Other approaches for bone loss and addressing bad breath. Beyond the primary treatments, there are other valuable approaches for managing periodontal bone loss and tackling the complexities of bad breath. For periodontal bone loss, regenerative and modulatory approaches. While osseous surgery resects bone to create a cleansable environment, the ultimate goal for many advanced cases is to regenerate lost bone and supporting tissues. 1. Guided tissue regeneration, GTR, and guided bone regeneration, GBR. These are surgical procedures aimed at encouraging the body to rebuild lost periodontal tissues, bone, periodontal ligament, cementum. A biocompatible membrane is placed over the bone defect after cleaning, creating a protected space. This barrier allows slower-growing bone cells to proliferate and fill the space, preventing faster-growing gum cells from migrating into the defect. These procedures are often combined with bone grafting, using the patient's own bone, donor bone, animal bone, or synthetic materials, and/or growth factors, like enamel matrix derivatives or platelet-rich plasma from your own blood, to enhance regeneration. Unlike resective surgery, GTR/GBR aims to restore the lost support structure, potentially saving teeth that would otherwise be lost. 2. Host modulation therapy, HMT. This approach focuses on altering the patient's inflammatory and immune response to the bacterial challenge, rather than solely targeting the bacteria. Periodontitis is not just a bacterial infection, it's the body's overreactive inflammatory response that causes most of the tissue destruction. An example is subantimicrobial dose doxycycline, SDD, a low dose of the antibiotic that inhibits destructive enzymes, MMPs, in inflamed tissues without acting as an antibiotic. HMT is an adjunct therapy that can help reduce the destructive inflammatory cycle. 3. Probiotics for oral health. This involves introducing beneficial bacteria into the oral cavity to outcompete and suppress harmful, disease-causing bacteria, aiming to restore a healthy microbial balance. Available in lozenges or chewable tablets, specific strains have shown promise for managing gingivitis and mild periodontitis, and for improving bad breath. It's primarily an adjunct for overall oral microbiome balance, not a standalone treatment for advanced bone loss. 4. Ozone therapy uses ozone gas or ozonated water, a powerful oxidizing agent, to kill bacteria, viruses, and fungi. It's applied directly to the gums or into periodontal pockets as an adjunct to traditional cleaning methods to disinfect areas and promote healing. While some studies show promise, more robust clinical trials are still needed to fully establish its long-term efficacy as a primary treatment for advanced periodontitis and bone regeneration. For bad breath, halitosis, beyond oral bacteria. While bacterial plaque and gum disease are common causes, halitosis can stem from other sources that aren't solely dental. 1. Tongue coatings. The back of the tongue is a significant reservoir for odor-producing bacteria. Regular tongue scraping or brushing is highly effective at removing this coating and reducing volatile sulfur compounds, VSCs, that cause bad breath. 2. Dry mouth. Xerostomia. Reduced saliva flow means less natural cleansing of the mouth. This can be caused by medications, antihistamines, antidepressants, systemic conditions, Sjogren's syndrome, or mouth breathing. Treatment involves staying hydrated, using saliva substitutes, chewing sugar-free gum, or addressing underlying medical conditions with a doctor. 3. Dietary factors. Certain foods, like garlic or onions, produce sulfur compounds that are absorbed into the bloodstream and exhaled. High-protein, low-carb, ketogenic diets can also cause a distinct ketone breath. Dietary modifications, coupled with excellent oral hygiene, are key. 4. Systemic health conditions. Bad breath can sometimes signal underlying medical issues. Respiratory tract infections, sinusitis, postnasal drip, bronchitis, or lung infections can produce foul-smelling mucus. Metabolic conditions, uncontrolled diabetes can lead to a fruity breath, while kidney failure might cause an ammonia-like odor, and liver failure a musty smell. Gastrointestinal issues, conditions like GERD, gastroesophageal reflux disease, can cause stomach contents to reflux into the mouth, leading to sour or foul breath. Managing the underlying medical condition with a physician is essential for these causes. 5. Tonsil stones, tonsilloliths. Small calcifications that form in the crypts of the tonsils, trapping bacteria and debris, leading to a foul odor. They can sometimes be gently removed at home, but persistent cases may require medical consultation with an ENT, ear, nose, throat specialist. Navigating your treatment decisions. While the idea of surgery can be daunting, it's important to view it as a targeted solution for specific areas that genuinely require it to achieve lasting health. For areas with advanced bone loss and deep, complex pockets, solely relying on repeated deep cleanings and occasional antibiotics or antimicrobials may significantly slow down the progression, but it's often not sufficient to completely stop it or prevent future tooth loss. Your dental professional will guide you through this process, explaining the benefits and risks of all options. The ultimate goal is to achieve a stable, maintainable periodontal health that protects your teeth, improves your quality of life, and supports your overall systemic well-being for years to come. Open communication with your care team is vital to making an informed decision that's right for you. Conclusion. Periodontitis is a complex, chronic condition, but with the right approach, it is manageable. While non-surgical methods like deep cleaning and various antimicrobial therapies, including at-home options like PerioRestore, are foundational, they often serve as stepping stones. For persistent deep pockets and bone loss, more advanced interventions, including surgical procedures like osseous surgery or regenerative techniques, become crucial for long-term stability and tooth preservation. Remember, successful management hinges on a partnership, your diligent home care combined with consistent professional evaluation and tailored treatment. By understanding the full spectrum of available options and engaging openly with your dental professional, you can make informed decisions that protect your oral health and overall well-being for years to come.